Hello and welcome to the Workforce Wisdom Podcast. I'm your host, Christy Bray, Chief Strategy Officer at PracticeLink. In this podcast, we will focus on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Industry Insights, Recruitment Excellence in Healthcare, with my friend, Jenna Smith. Jenna has been in provider recruitment for over 12 years. She's had the pleasure of working for a variety of medical groups and models, including large hospital system, an FQHC, and a concierge startup. A vast majority of her career has been focused on outpatient primary care, including the very hard to find internal medicine, family medicine, pediatrics, and OBGYN, along with urgent care. Welcome, Jenna, to today's podcast.
Hi, Christy. Thank you for having me. It's a pleasure to be here.
All right, we're going to get started and just jump right into some challenging questions about the recruitment process. So in your roles, you've managed various stages of the recruitment process at multiple organizations. How have you seen recruitment evolve over the years, and what key strategies have you found most effective in attracting top talent?
I think back to when I sort of stumbled into provider recruiting, and it was archaic at the time. I didn't know any better, and I was legitimately using health grades because at the time I was working for an organization and we had practices and clinics all throughout the country. And I would use health grades and call in to practices and either sweet talk the medical assistants or the receptionist to try and leave a message or get connected to those doctors. And I think back and I'm kind of befuddled that we had any amount of success at that time because it just seems very elementary what I was doing. I just wasn't savvy and I didn't realize that there were platforms and databases. And at the time too, I didn't even have a budget. And so it was really just stumbling into what worked and then having to pivot and figure out, other ways to do it. Eventually, I had a little bit of a budget, and then I had colleagues that were like, oh, hey, there's these tools out there. I'm like, oh, hey, cool. That makes a big difference in recruiting. And so again, I just think back and I can't even believe that there was success given the lack of tools I was utilizing at the time. I think over the course of time, just having colleagues and understanding that there are networks out there and there's associations that you can sort of plug into to help not only your recruiting needs, but organizational strategy has been helpful. I think the biggest thing that I've noticed over my career, and the thing that I think that providers and candidates have come back and said to me that has allowed me to be successful, is under-promising and over-delivering. And those constant touch points, even if I don't have an update, following up with the candidate and saying, I'm still waiting to hear from my stakeholders, but I just wanted to check in, hope you're having a good week, let me know if anything has changed in your landscape of finding a job. And I think that that's really been my success in terms of engaging with those candidates, is just those regular touch points and making them feel seen and heard and thought of, because I think all of us are going after the same candidate pool, right? Whatever specialty it is or whatever, we're all focused on that same candidate pool. And so how do you differentiate yourself as a recruiter in your organization from those others? And for me, it has been those constant touch points and communication. And even if it's not some big update, at least they're hearing from you and you're staying in their inbox or you're having those phone conversations, I think has been a big difference for me.
You mentioned working closely with some of your stakeholders across different departments. How do you really work through that alignment if it's between HR or an operations or administrative team? Are there any other teams that you have to kind of reach out to and stay aligned?
I think sometimes your internal stakeholders can be the biggest challenge in recruiting, and making sure that you've developed those relationships with them, you understand their expectations and their needs. And, I think back to a few stakeholders that really took a lot of time to establish a working, positive relationship with. I remember when I was working for a hospital-based system here in the greater Southwest, and I had a stakeholder who was challenging, and he was kind of known for being your curmudgeon. So I got in the car one day and I'm like, okay, I can't do this anymore. Like, I've got to go out and physically spend time with him and kind of break down that barrier. I mean, he just was a little bit of a negative Nancy, and it took the time to go out and really say, like, he just needed to be heard. He needed to be heard. He needed to be seen. He needed to be recognized. And I think once we got over that hurdle, it just changed the dynamics of our relationship. And all of a sudden, he wasn't so opposed to every candidate that I sent him. You know, he was more willing to listen to me and take time and feel that what he was sharing with me in terms of feedback was validated. And sometimes you just have to figure out, and I would say this goes for stakeholders and this goes for candidates. Sometimes if it is challenging or there's a little bit of butting heads or feeling as though there's not alignment in what you're doing, how do you connect? And I think sometimes it's not just a working professional experience you have to sort of cultivate. It's a personal one. So how do we connect as human beings, as people? And that allows you to get over those speed bumps in your relationship, to realize that you're all on the same team. You're not opposing forces. You're really working together in an effort to get across the finish line. But let's connect as people, not just professional colleagues.
Yeah, I found that what I would try and remind some of my recruiters of the teams that I led really was recruitment is our number one thing every day that we jump out of bed to do. But most of those operators or even HR teams that you're working with, it's not. It might be eighth on their list in terms of physician recruitment or provider recruitment. And so understanding they got called into a clinic because there's no person at the front desk or there's no MA for the day. And so from a staffing perspective, they have such a broader scope than our one thing. Sure, we want them to call our candidates right away and get the offer ready or the contract, but they have thousands of things usually going on in a day that we're not always aware of.
And like you said, I mean, we are just so focused on recruiting, and it takes a certain skill set and individual to recruit. And they don't understand that about recruiters. And we as recruiters don't understand, like you said, the scope of what they're dealing with. I think about a time when I sort of realized, and this was when I was doing outpatient primary care recruiting for a large organization. We had multiple clinics throughout greater metropolitan Phoenix, and then even a number of those hard to fill rural locations. And I remember thinking or identifying at the time, it was hard for me to sort of circle the wagons after a site visit to decide, is this somebody we want to move forward with or not? And what I discovered was, in particular, a candidate was like, hey, before I even left the site visit at XYZ organization, I had a contract in hand. And I was like, oh man, we are missing this. We've got to move faster. And it's not to say we want to make the wrong decision, but like, what can we do? And so I implemented with my internal stakeholders. After the site visit, we had a captive audience. They were all there. They were all together. And so I said, okay, fine. We are going to do a team huddle after that site visit very quickly. And it doesn't have to be long, but it's a 5-minute phone call. We jump on the phone and say, is this somebody that I should request a contract for and we want to make an offer to or not? And then all of the sudden, within the next few weeks, because we implemented that touch base, we were closing contracts and candidates in a much better fashion. Our close ratio really increased. And that's all it took was, hey, you guys are all together. Let's decide this now. Let's get the ball rolling. Let's not wait a couple days to find time on each other's calendars to come back together. Let's strike while the iron is hot. And it made such an impactful difference. And I happened to see a former colleague recently at a conference. And I asked her, I said, are you guys still doing that? And she said, we are. And it really lended itself to be very successful in our closing rates. And so it seems small and almost silly, but it is those little moments of where you come together as a team in an effort to spend a couple minutes to really identify what we could be doing better to smooth out the recruiting process and obtain more signed candidates to providers. And it was small but meaningful change in operationally what we were doing. And I think it helped align like those operations and HR people with the recruiters to understand how can we work together.
And I think learning, you got the tip about your competitors from that candidate. So it's important equally to ask them for their feedback, either in a written survey, something they can send in, or just casually asking, what else are you looking at? And what does their process look like? I think we've all probably learned the people down the street do it a little differently or a little quicker in some cases. Yeah.
Absolutely. And you never want to switch that level of quickness or responsiveness. You don't want to give that up in terms of quality of candidate. But again, your quality candidates, you do have to move fast because you are going to lose them to somebody down the road. And it was a kind of those aha moments that I think kind of can tend to be challenging in such a competitive market to substantiate yourself from XYZ organizations or other recruiters.
And I think what you touched on a little bit is, as a recruiter, you're not doing your job if you're passing through candidates who aren't quality. Don't waste the time or spend the money bringing people in for site visits or things like that if there is an intent to hire. So you've done maybe some background check, you've done your pre-work and vetted them, you've talked to them probably at length. Some of the stakeholders have also called them. So those are important things to set the stage that when you get there, you're ready to come together and make an offer to this person. So I think that pre-work is where a lot of people go too quickly when you get people on site and you go, ooh, not even close to what you were looking for. And I think that can degrade your relationship over time with your stakeholders. They feel like it's a waste of time.
Absolutely.
If you're not bringing the right people to the table. So as you recruit to something like concierge medicine or the private practice versus a large health system, what are some of the differences you see? Most people would say, ooh, smaller. That means you're quicker, more nimble, you've got things going. I would disagree with that because usually there are internal forces that hold you back. Concierge is so unique in the market. You get people who really want to do it and people who don't understand what you're doing. So you spend a lot of time explaining. And then large health systems, equally for-profit or not-for-profit, can turn people off in different ways. So what are some of the differences you've seen in those types of settings?
Absolutely. I think the smaller kind of startup organization, and we did start with concierge outpatient primary care, and then that evolved into employer-sponsored direct primary care, right? And I think one of my favorite things was from a provider that I had the opportunity to hire. Months later, when he had started, he came back to me. He said, I'm just like a glorified school nurse for a bunch of adults. I always loved that. It was Dr. Dale Spencer. God bless him. I love him. Still hear from him occasionally. But there was a little bit of like, this is a startup, right? And we were sort of on the cusp of direct primary care sort of taking off. And it was unknown. There were some challenges and sort of scrutiny around, is this really feasible for my career? Is this stable? Is the longevity going to be there? And anything with private practice too, smaller groups, it was challenging to get those internal stakeholders to adhere to a somewhat fast-paced recruiting process. I mean, there was a lot of education and a lot of advocacy for them to understand what it takes to land these providers. Once we were engaged with them, it was foreign to them to have sort of this streamlined approach. You'll laugh because I think you probably remember this. There was an employer that we had partnered with in Mount Pleasant, South Carolina. And I remember after the intake call, laying my head down on the desk thinking, how am I ever going to find this person? And also thinking they were so specific. And I just thought, they clearly know who this provider is. Like, could you just give me the name to go find this person? Because obviously you've modeled what I've constructed on the intake call to be very specific. And you must have somebody in mind. And I'm probably going off on a little bit of a tangent here, but this does happen to be one of my more favorite recruiting / almost stalker-esque examples. But it took me months and I finally found this woman, and it appeared to check all of the boxes for these guys, but I couldn't find her. It was like she just evaporated into the ether. And where I eventually found her was a picture of she and her husband at a Clemson football game at a tailgate alumni party. And I found him. I found him via LinkedIn. I found him via his employer's website. And so I started reaching out to him. I was like, okay, well, I can't get a hold of her, so I'm going to go through him. And he eventually called me back and he said, I don't know if I should be scared of you, but at the same time, I'm also somewhat impressed with your tenacity and your drive in order to have this conversation with me. What can I do for you? When I talked to him, I said, yeah, I found your picture, and I kind of explained the whole thing. And we ended up interviewing her, and she did sign, and it ended up being a really successful story. And you just have to sometimes really listen to your internal stakeholders. Or sometimes, I've been with organizations that your candidate, your internal operation stakeholder folks, and then sometimes you're partnering with these practice leaders. There's 3 audiences of people that you've got to check all those boxes for. And what I have learned over these 12 years is it is recruiting, but it's also matchmaking. And sometimes there's a variety of people you're matchmaking with, and you can't lose sight of that. And you can't force a square peg into a round hole. And one of the things that I feel that I have incorporated into my song and dance, if you will, of candidates is reminding them, I know I'm working for XYZ Medical Group. I really do want to fill this need, but I'm also working for you. And I want you to know that I respect you. I hear you. I'm asking the questions, what's important to you? And I've had those tough conversations with candidates to say, as much as I want to move you through this process, I don't think we are aligned. Or I know for certain that compensation package is not what I can offer, especially, in private practice. It's tough. I remember working with a group in Austin, Texas, a number of years ago, and I had to say to these guys, I know that it's been a long time since you've brought a new provider in. You've been able to keep these providers, but there's a lot that has changed, and you need to look at this compensation. And what you're telling me is you want a U.S. trained individual to come in here from some accredited programs like Mayo Clinics of the world. But what you're offering is not anything that they are going to get excited about. And that's when you have to share with them. You have to partner with them and consult with them to say, you're wanting this top tier A-rated person, but your package is like a C or D level situation here. It's not aligned. And I do remember having a initial conversation with a candidate who was coming from California, and she was coming from Kaiser. And she said, you are doing yourself and this organization an injustice to recruit. And I'm actually somewhat offended that you've taken my time. And I was like, no. And it was rough. And I had to go back to those stakeholders and say, hey, you guys, until you're ready to be somewhat in the ballpark of fair market value with what you're offering, I can't recruit for you. I can't do it. You guys need to internally have these conversations. Here's all the data that I've provided you. Here's all of the homework I've done on my end to say to you, this is where you need to be in order to even attract candidates, much less sign somebody. And it was uncomfortable. They were angry. But in the end, it was apples and zebras. I mean, it was just not a winning combo for anybody involved. It was uncomfortable, but I think in the end, they did come back, this group in particular, and they said, okay, we appreciate the information. We appreciate the market data. We appreciate all these price points, if you will, and it's given us some pause. And they had to make some changes, substantial changes, before I could go actively recruit for that. And they did eventually. It took some, it took some time.
Yeah. Sometimes you get those practices, and in large health systems also, where you don't want to disrupt the internal equity. And we all understand that. I know pay transparency has become a very, very big issue. I don't mean that in a negative way, because I do think it's a good thing, but it's difficult with physicians with their compensation model and the packages and the things you add in. But I do think it's important. The more we talk about pay, the better it gets for everybody.
We recently had a situation where a pediatric nurse practitioner who's been with the organization a couple years noticed a job ad out there. And in the job ad, it talked about a sign-on bonus. It didn't stipulate the sign-on bonus amount, but she was like, hey, I didn't get a sign-on bonus. That was never talked about. Is it 5,000? Is it 50,000? Like, what the heck? And it ruffled some feathers, and I know she wasn't happy. And then she made a little bit of a stink, and I get it, rightfully so. I mean, kudos to her to understand her worth and say, wait a second here. And if you want to retain me, then let's talk about this. But it really caused the medical group a little bit of pause. And then all of a sudden it was like, hey, we don't want to do sign-on bonuses at all then, if this is going to upset internal folks. But then again, as recruiters, we had to go back and say, well, okay, we can appreciate that. We don't want to upset everybody who is currently working for the organization. But if we totally eliminate this, we're not being competitive in the market again. And it's kind of that tit for tat. Like, are you going to rob Peter to pay Paul? And it's kind of trying to find that middle ground. And sometimes it's going to work. And sometimes you have to keep evolving and pivoting to figure out what works best to attract those candidates and also then keep the candidates after you've attracted them, and it's tough. It's tough.
And I think the more popular model of paying some of that money either upfront or over time as a function of trying to retain them is important. And we've worked in a health system that I thought did this very well in the way that they staggered the payouts. But you do have to make that investment if you're going to be in healthcare to be able to retain those people over time. It ends up being pennies that you argue over for some of the sign-on bonuses, especially as you get into specialty care and surgery, where it is just pennies that you could have saved face in front of that candidate and gotten them a little bit more sign-on bonus or relocation or student loan assistance. So a lot of the work you've done within primary care and now some within the behavioral health, these are top 5 hardest, most critical. The shortage is not going to end in our lifetime for these folks. But what are some of the unique challenges, recruiting those specialties, maybe compared to others that you've had in your career?
I think one of the biggest things that has presented itself in particular since COVID has been the shift of so many family medicine doctors, internal medicine doctors. I mean, really outpatient primary care. Yes, it is a shrinking candidate pool, and we all know that, and there is a shortage. But I think the bigger thing that has presented itself is how many of these folks do not want to be in a clinic anymore. They want to be like this. They want to be virtual. They want to be on a screen. And a couple of years ago, when the American Academy of Family Practitioners finally hosted their in-person FMX again, I was so excited. Some people were still wearing masks and distancing and all of that, but I was so excited to be in person again and be able to have conversations with folks. And I think when I left that show, I couldn't believe the number of providers who came up to me and said, do you have anything virtual? Do you have telehealth? No? Gone. And so it really shrunk that candidate pool even further for those of us who were recruiting for in-person clinic-based practices. It was baffling. And I get it. We had to figure out a different way to function and deliver care during that time. And I can appreciate it, right? I mean, we all adjusted and it was like, hey, telehealth is a thing and at least you still get to see your doctor and so on and so forth. But I think the longevity of that, it brings me pause and question. I mean, not only as a recruiter, but as somebody who sees healthcare providers, right? And the importance of physically being in the same room as your primary care doctor. I mean, it's great to see this up, but what's going on? You're neck down. And so that, I think, has been something that I never thought was going to be such a challenge within recruiting, is the virtual aspect of it and the telehealth desire. And even so, you mentioned behavioral health. That is a tough market to begin with. I think that there are not nearly enough providers for those of us in the world who recognize the importance of mental health and behavioral health, and bringing those folks in, whether it's a type 2 diabetes diagnosis and kind of understanding what that means and how that flips a switch, or cancer diagnosis, or any of it. And so how do you leverage those folks? And so many are like, hey, is this virtual? If it's not virtual, I'm not interested. It's tough. And the world has kind of gone back to what it was before COVID, but also the expectations haven't with providers. And I understand it. As a recruiter, I'm looking for remote work. I want to be somewhere that I can work from the confines of my home, but that's different. It's hard for me to wrap my head around that mentality with providers, and it's challenging. I would say that that has been my biggest challenge over the last number of years, to not only have to recruit from a dwindling pool of candidates, but then you add another level of folks who remove themselves from a typical clinic-based primary care opportunity because of that.
Do you want to know when to do what in your job search? First Practice, PracticeLink's resident and fellow career guide, teaches you 10 easy-to-follow steps every prospective physician needs to find their dream practice. And best of all, it's completely free at firstpractice.com. Becoming a physician is hard. Finding a job doesn't have to be. Thank you for listening. Now we'll return to the podcast.
Recently, PracticeLink hosted the keynote speaker for the Southeast Physician Recruiters Association. And, one of the things I said to that group is, when you're looking at how attractive is that work schedule, you and I have worked in a remote environment for a very long time. I don't think either of us would volunteer to go back into an office every day ever. It allows us time with our families to keep a household. And as single moms, that's kind of our thing. But I would say, as I talk to that group, if your job is 8 to 5, 5 days a week, you're losing. So we have to be able to find a way to, yes, meet the patient needs, which a lot of them don't want to drive into bricks and mortar anyway. They understand surgery and those types of procedures require somebody to touch you. But otherwise, that's why the things like Amazon, same day delivery, and any of those things we have, Uber Eats, like any of those things are so popular because people are comfortable at home. They're not wanting to get out in the world. And so trying to meet them where they are. And then again, on the workforce side, these providers have thousands of options for jobs. The hardest thing now is if a job for primary care and for behavioral health, if those are telejobs, they're number one on the list to get filled. After that, people really look at locums work because they can work when they want, where they want, for as much as they want, usually name their price. And then they'll look at your 4-day, 5-day a week, 8 to 5 call, no call, burdensome. As you add to that, your pipeline gets smaller. And I think it's tough for folks to realize, yeah, these kids did go to medical school and they wanted to help others, but that doesn't mean they're sitting in the same room all the time. They want to help others in a different way. So trying to recognize some of that to where we still need some people to come back into offices is tough, but you probably need to incent them a little bit more, maybe pay them more. At least the residents I've talked to in primary care, they were willing to make less. They understood, I really want to come out and be a 0.8, and I want to work a day or two at home doing tele. And they honestly can get more done at home than running around in the chaos of a clinic. But that's an interesting dynamic because most health systems and the bricks and mortar you invest in, it's hard to pivot that and let somebody do that. But that's where most places need to be if they want to make their jobs attractive. It's a hard sell.
I don't think any of us as recruiters, well, society, humans, never really saw the impact that COVID was going to make on all of us. And it did. It just really, really changed the landscape and the expectations for all of us. And how do you get creative and how do you meet somewhere in the middle to make a candidate feel happy or that they're getting what they really want, what's important to them? It's been an interesting time to adjust those expectations for all of us in the recruiting world.
I know you said early on in your career, you didn't realize there were some of these tools and those things out there, but as you've implemented applicant tracking systems and handled data management, reporting up to your leaders as you manage teams, tell me a little bit about the role of data and technology in what I would call today's recruitment, and then using those to either improve efficiency or in cases where you needed to grow your team and substantiate, we need more help in certain scenarios.
So it's huge. I mean, it absolutely is huge. And I think a lot of time, anybody in operations, or if you're having to build a case for changes, even if that's the number of FTEs you're recruiting for, or if it's the compensation or whatever. I mean, you've got to have the data to back up your business decision. I mean, how is this really going to impact? And I think, one of the times that bubbles up is that group down in Texas for me, where they were like, where are you getting this information from? And then when all of a sudden it was like an arsenal of a lot of information, they're like, oh, okay, this isn't just some recruiter trying to create some sort of business decision to make her job easier. I mean, this is what I'm talking about. I'm not just making this up. I'm not just trying to like cut corners or whatever. And, I've worked for organizations that I think back to a boss that I know you know him as well. And, Jamie, and he was so data driven. I mean, everything required a substantial amount of data, a lot of reporting for him to make the business case to make any adjustments in any capacity. I mean, it really had to be vetted out. And I think too, a gal that I worked with for an organization, her name was Heidi. And again, like she was just so numbers driven. And I am a recruiter, right?
We're not doing math.
Oh, exactly. I'm like, there's a reason why I was a journalism major in college. Like I took accounting and I'm like, oh boy, this is not good. Like I'm celebrating getting a D. I better figure out a different path to get my degree or I'm not going to get one. So the applicant tracking systems, there are some that just fill a need. And then there are some that are so robust in what they can do in creating those metrics and those data points. So I think as a recruiter, you have to kind of figure out what is it that my stakeholders are looking for and what is going to help me remove the red flags to make any decisions, or what is going to eliminate those challenges to implement whatever the case is to get more candidates. But the onus is on you to figure out how to build that case. You have to adjust. I mean, I remember the first time I had to figure out a pivot table in Excel, right? And that's not even an applicant tracking system. And I was like, oh my gosh, what have I gotten myself into? I don't know what you're saying to me.
Self-taught pivot tabler.
You might as well be speaking Japanese to me for as much as I'm understanding what you're saying to me. And that's the thing, is it gets you out of your comfort zone. And most of the time, I think you can look back and say, okay, now I understand. I understand the need. I understand what those numbers and what that data really presented in order for me to make the change, or the business need is there. You've got to kind of substantiate it. And data and applicant tracking systems help you do that. I mean, I remember moving through even creating like a flow chart, but you had to have the data to say, okay, I've got one opening and I've had 18 candidates. And then that has kind of narrowed down to how many pre-screens and how many follow-ups and how many site visits and blah, blah, blah. But that's imperative for you to make any case. I think it helps recruiters to even substantiate how many requisitions that we can manage appropriately to the people who've got 40, 50, or 60. Is that a good use of their time? I mean, are they really impacting the business needs there? And are they really filling those positions, or are they just spread too thin? And I would say they're spread too thin. They really can't focus on anything at that point. I mean, they're just being pulled in too many directions, but I don't think you can build a case for yourself in any one of those arguments unless you've got the data to substantiate what you're doing. And there are tools out there that they've got a lot of robust reporting that you're not having to slice and dice and create yourself. And then there is some out there that, not everything is created equally, and identifying what reporting techniques and tools you can use to substantiate that. Early in my career, I probably spent an obscene amount of time building templates and PowerPoints to validate what I was doing in life. And now I've realized, there is a lot that you could just click a button. If you are timely and doing the right thing to put the data in, it'll spit it out appropriately in those reports that will help you build those cases.
And I think any ATS or CRM, from a data management, it's only as good as the data that's put in and, kept up to date. I know we worked on building applicant tracking system a little bit together one time. And as I've done that in my career, I mean, I always started with, what did you want the data output to be? And that would drive the fields and things that were required within the ATS from a data input standpoint. Because if you don't have that, you can't get to good data that helps make decisions.
Yeah, it is. It's a totally work backwards. And I think for somebody who's very linear thinking, that's a tough concept to manage. But certainly not all data is built the same. And like you said, I mean, garbage in, garbage out. And it's tough when you look at your schedule and you're like, hey, I've got 4 pre-screens today or 4 interviews or, whatever the vernacular is that an organization uses. It's like you have to almost build that time into your schedule to make sure that the data entry is happening. Otherwise, you get yourself in a hole. I will admit, I'm a little behind right now with my data entry. And I realized the other day, if I don't do something about this and put time on my calendar to really spend the time to get myself out of that hole, it's only going to make it worse. It's hard to dig yourself out of a hole, and it's hard to realize, oh, I've let this slide. And now I've really got to do some serious time and effort to get myself focused, to get that data input so I can kind of start from a level playing field again.
When I was interviewing candidates and going through that recruitment process, really being really tight with my time, and I'm blessed with the ability to type while people talk and ask questions, just from being an executive assistant way back in the day and sitting through super exciting board meetings. And so I'd always tell the candidates, listen, if you hear me typing, it's because I'm taking some notes on our conversation. But then when I would get to the end, I would proofread it and go through things. Now you've got ChatGPT, you could record it, it will transcribe it. So the technology should make people faster as long as you're leveraging that and that candidates are okay that you're using it. But I loved it because I could edit and proofread, save it. I already had templates made, like you said, and it went straight to stakeholders. Same text. I used quick parts in Microsoft Outlook. Didn't have to rethink it every time. And the stakeholders knew because it became routine for what they would read and open and then what their action was following that. So I do think it's important. I used to block every Friday morning because I knew towards the end of the week, we would roll out the next week, start pulling new reports down. And I didn't want to be the one that was called out on our stakeholder meetings for my data being old or stale. And at that point, anything older than 5 or 6 days was considered old because that's how fast we had to move with our book of business. So yeah, I loved that Friday morning time. And I did, I really did do it and go in and check the records or re-ping people that I hadn't heard from, either the candidate or that stakeholder. So I think that's a very good process. As you've mentored and managed different recruitment teams, you've touched on a couple of skills I wrote down. So collaboration, communication, transparency, and probably the fourth one, education, in a way, being able to articulate and speak to with confidence your leadership teams. But are there any other essential skills or qualities that the recruiter or somebody coming into this industry would look at?
Did you say accountability?
I did not.
So I would add accountability to that because look, we are all human and we make mistakes. And I think if anybody says that they are the absolute expert or they've never made a mistake, I would really challenge that person. There have been times where I made a mistake or I forgot, and how you go about taking accountability for that and saying, I made a mistake and let's figure out how that doesn't happen again. And how do we move on from that in a positive fashion? And let's learn and grow from that, I think is imperative, because anybody who is starting out is going to get overwhelmed because there's a lot of things that you're managing. You're managing a recruiting cycle. You're managing your stakeholders, internal and externally. You're managing the data. You're managing the job posting. And that changes regularly too. You constantly are having to go in and figure out, how do I take something stale and make it look new and exciting and captivating again? And so I think accountability is a huge thing. And I think that kind of falls under collaboration too. Somebody who understands that it is a constant moving target and we are always having to adjust and change and redesign, rethink. And certainly none of us want to make mistakes, but they're going to happen, and owning them and figuring out how do we make it better. And I think understanding that recruiting can sort of be a machine, but not understanding that there's human element to it in every single part of the process is really an oversight and something that I think potentially organizations can overlook. I just finished a very long 9 months of breast cancer treatment. And looking back, and I'm only 90 days into remission at this point, but what I would say, one of the things for me that changed maybe how I go about recruiting, now having this personal experience, and let it not be forgotten that not only was I going through cancer treatment, but simultaneously watching my father go through cancer treatment and his care team. And one of the things that was most impactful for me with my providers and that changed how I go about recruiting is the human element of it. I was sitting there with my provider weekly talking about how my blood work looks and how I'm coping and how I'm responding to all of this, and psychologically, emotionally, mentally, I mean, all of it, like physically, it's huge to try and wrap your arms around it. And one of the things that I realized with my oncologist was not only did she ask about me, but she spent a moment to ask how my dad is doing, how my mom is doing. And so very holistically, she wasn't just treating me. She was treating the things that were important to me as a patient. And it sometimes wasn't just about my health or my cancer treatment, but how my dad's care and treatment was going was impacting my outcomes. And so I think it really elevated my ability to ask those types of questions, those behavioral questions, if you will, in a pre-screen or an interview, to really understand what it's going to take to deliver outcomes in terms of patient care that's helpful. Really brings that human element to it. And I think it's tough to be a patient and feel heard and seen and valued on more than just a number on a chart or a number on my blood work or whatever the case is, but to really take a moment to address the humanity in the room. And there are providers, and I get emotional about it because there are providers that understand that, and there are providers that don't. And when I think back to my career, I would like to hope, think, pray that I have brought providers in that are doing that. I understand there's evidence-based medicine. I understand there's data, there's reporting, but there's also this very sacred humanity behind healthcare. And what can we do as providers to make sure that we are bringing in doctors and nurse practitioners and PAs and behavioral health consultants that understand that? Because it is a money-making machine, but the only way that any of us are really going to get through it is kind of acknowledging the humanity of it. And it's an art. And I think it's one of those opportunities for recruiters to really sit back and evaluate. I would probably have to say my journey in the last year has really changed my outlook on recruiting and providers, and also kind of what's important and sometimes what's not. And sometimes that's really hard to articulate to the people that are like, looking for metrics and performance and outcomes, to understand that a lot more can go into all of it.
At the end of the day, I always remind people we're not making buttons. We're not making chicken sandwiches. We're not bagging groceries. So the pieces and decisions that get made, and as recruiters, you absolutely affect the outcomes of patient lives, someone's grandmother, mother, son or daughter. And so you do have to take it seriously that indirectly we are touching patients every day. And those providers that you and I have placed over our careers, you do owe it. You owe it to humanity to make sure that they match that practice. And I always would say, are you comfortable sending your family member to that person? Because some people got into medicine for probably the wrong reasons, or medicine has made them that way over time, at least from the money aspect. And if the answer is no, I wouldn't go see them, or I wouldn't go to that hospital or something, it can be very hard to work through some of that. So thank you for sharing your personal journey with that. I'm so glad that you are on the other side of it and that we'll just keep positive thoughts for that. So, as we wrap up, is there any additional advice you would give somebody that's just starting in recruitment, and specifically within healthcare? Because as I said, it is very different. This isn't recruiting for tech, IT, attorneys. It's a very, very different space. But any advice you would give somebody who's just starting out?
Yes, absolutely. And this is probably one of the biggest learning curves that I have had to work with, acknowledge, work around, is the understanding to set expectations and understand that you are not going to change the world in a night, in a day. You are not going to come in and be the hero within a few days of working for an organization, right? Like, it's super easy to come in and identify things that need to be changed because we can all do that. I think sometimes where the beauty is in acknowledging and identifying the things that are working and how do we leverage that to make it even better. Sometimes those are easier fixes than to look at an organization and think, I have some magic wand and I'm going to fix everything. And I still even experienced that 7 or 8 months ago when I started with the new organization and took inventory as to what's going on. And again, very quickly, I was like, oh, I'm going to fix this. Like, this is great. I have the opportunity to come in and make an impact. And it's not to say that I haven't, but I think having the patience to really holistically look at the big picture and take the time to get to know your stakeholders. And rather than just go about it in a very maniacal fashion, is just really understand and have sometimes those conversations that maybe aren't about business development or how to fix a problem or how to adjust a process, but just getting to know somebody and understand how they operate or how they work. And that might be internal, and it certainly is external. And I think the other thing that I would probably say to Jenna 12 years ago is never losing what makes you unique. Don't ever allow an organization to dampen your passion and your zest for life and your career. And what you do as a recruiter, it takes a certain person, right? It takes a Christy. It takes a Jenna, it takes a Pam, it takes a Joanna, it takes all of these people, right, who have been in healthcare recruiting long enough to understand the nuances of it. I think even for me recently, I've kind of questioned, maybe I get out of healthcare. Maybe I'm burned out. Maybe being a person who has been so focused on bringing providers in that has now been exposed to countless appointments, countless providers, different specialties. Like, maybe I'm over it. Maybe I'm done. But I think at the end of the day, it's hard to walk away from. And it does take a certain person to understand why it matters and how impactful we can be. And so I guess I would say, certainly there are days you're going to get up from your desk at the end of the day and go, that was a doozy, right? Or that was an interesting interview, or why did I waste my time doing that? But all of those things help us to be better and look at each day and look at each opportunity and look at each opening with a different set of eyes. And the biggest thing I would say is understanding the importance of communication on a regular basis, those touch points, internal and external. That's important because I think sometimes we lose sight of that. And even no news is still good news sometimes. And making sure that whether it's a candidate or a stakeholder, the communication piece, I would say, under-promising and over-delivering. I feel very fortunate that I've had an opportunity, even very recently in the last couple of weeks, where one candidate reached out and said, my interaction with you is the absolute reason why I'm moving forward and signing this contract. Another candidate said, I've never had a recruiter that I've connected with and that I felt so strongly about, but also I'm signing with somebody else, And so it was like, oh, that feels good. And oh, that's such a bummer, But at the end of the day, for her, it was a timing and it was a location and it was, hey, these people are going to give me a little bit more money. But the fact that she even took the time to say those things to me, it helped me to like go on another day in recruiting. And so don't ever lose sight of the impact you as a recruiter, as a person, can make in the lives of these providers. It's not to be taken lightly. And I hope for me too, that I can impact providers to make those hard decisions. I want to go with this organization or I don't want to go with this organization. Sometimes knowing what you don't want can be as meaningful as knowing what you do want.
Yeah, exactly. Yeah. And I think that some of what you said in terms of that communication piece, I mean, that, you know, it goes for life as well in terms of that relationship you developed with that physician. Although they didn't take the job now, I guarantee when they're looking for another job, they have your number, they will call you. And I know oodles of recruiters that they have followed up and stayed in touch with candidates. And when the candidate needed advice, hey, I got a new contract, I'm looking to leave, something happened, you know, I do need to move closer to family, this and that. And then I think connecting them either with trusted recruiters or you're that person and you have that opportunity that they want to look at there. So a lot of what we do is about timing, the right time in anybody's life for them to make some of these moves. We have the opportunity to hold the future in our hands with so many of these new physicians and new advanced practice providers and behavioral health specialists, where it's pretty awesome when you think about the humanity of it and the pieces that we get to impact in our careers. So it's been awesome to catch up with you and talk through your career and the success that you've had and the impact you've made on lives, not only there in the Valley, but around the country.
Well, thank you for your time, Christy. And I feel very fortunate that provider recruiting is how I've come to know you. And I feel very grateful for that.
Thanks for joining us today. For more information on how Enlightened can help your organization with curated top-tier healthcare experts on demand, visit getenlightened.com. That's GETINLIGTENDED.com. For listeners, feel free to reach out with any thoughts, insights, or questions about anything we covered today, or if you wish to receive more information on how PracticeLink can help both physicians and recruiters, please visit our website or email plmedia@practicelink.com. My name is Christy Bray. I thank you for listening to Workforce Wisdom.